Hi, my name's Rena. I'm a pharmacist at SG Bry Pharmacy in Sutton in Surrey. And here are some of the measures we've put in place to support our patients who are using our pharmacies during this crisis. We've had to think about how we manage the control of crowds that are coming into our pharmacy, and we have fortunately had to restrict it to having 3 patients at a time in our pharmacy. We've been updating our front door with the key messages about coronavirus, and we've also had to put a sign up to let patients know whether we have hand sanitizer, thermometers, and things like that, because people are coming in all the time asking for these items. We've had to stop all non-urgent face-to-face consultations in our pharmacy as well, so we provide support for people who give up smoking, for example. We've had to postpone those or do those consultations on telephones. We've put social distancing measures in place, so we've put blue tape on our floors and created clear aisles where patients can wait, maintaining that social distance between each other, obviously, while they're in the pharmacy. We've had to put some physical barrier in between us and our patients as well, so we've had to use some makeshift ideas and Blue Peter style, and we've used our chairs to create a barrier around our counter so that we can keep that social distance between us and our patients. In the dispensary, I'm filming this morning, having come in early, like loads of my community pharmacy colleagues have been doing, to try and just catch up with the sheer workload that we're experiencing at the moment. Here are my deliveries that needed to go out today. We've had a 3-fold increase in the request for deliveries, especially to patients who are self-isolating now, so we're having to take extra precautions when we do deliver to these patients. In terms of my shelves and my stock, we are limited. We've almost run out of our paracetamol now, and we are limiting all items to just 1 per patient, including sanitary products, all of these products, because the thing that's most important to me is supporting my vulnerable community. So many elderly people rely on my pharmacy, and if I sell everything to people who are trying to bulk buy at the moment, it won't be fair on those who genuinely do need it as the crisis continues. So we have put a strict policy in of 1 per patient, and most patients have been very understanding of this. Here is our sheer workload at the moment. You can see the number of baskets of prescriptions that need checking still. We've got prescriptions that have come in overnight that I've pulled down. I stayed behind last night to pull down. We are coping, but we are struggling with the volume of people coming in. My staff and my team are being amazing by coming in. They're putting themselves at risk, and we have had patients who are coming in with potential symptoms who should really be self-isolating. So we're having to say to these people, please take heed of the national guidance about, if you have those symptoms, stay at home, maintaining those social distances between people when you come into our pharmacy, for example. We're working really closely with our GP colleagues as well, who obviously are trying to stay open to see patients, but we both need to stay open for this to work, because obviously if patients see a GP or a nurse in their surgery, they need to be able to have access to medication, and that's absolutely essential. We really do feel like we're propping up the NHS here. We are key workers, despite not being mentioned formally in the list of people, under doctors, nurses, midwives, and we are really keen to stay open throughout this, to really support our patients to stay well and keep that flow of medication and important medical products going throughout this period.